I think once again it's very interesting to see that some hereditary diseases that were depicted in the 60s and the 70s were based just on clinical criteria. And now that we have the molecular marker, the genetic identification, all I would say the sophisticated tools of precision medicine, we know more about these diseases. And the spectrum of the disease is broader than we thought initially. So it includes, of course, colorectal carcinoma in the vast majority of cases, but other cancers, such as gynecological cancer in women, endometrial cancer, for instance, and also urothelial cancer. The urothelium is the epithelium that lines the bladder and the renal cavities. And during the session, we spoke about upper tract tumor, which is a subtype or a cousin or a fake twin of bladder cancer. This is an important issue because as soon as we can identify a patient who belongs to the HNPCC, hereditary non-polyposis colorectal carcinoma spectrum, there is the possibility to influence, I would say, the outcome by choosing a specific treatment. It has been demonstrated in the field of colorectal cancer, where when the tumor displays the characteristic of microsatellite instability, they choose a specific chemotherapy that they do not use in sporadic cases. We are not there yet in urothelial cancer, but we are looking into that direction, trying to assess what would be the perfect regimen of systemic treatment for these hereditary cases. Yeah, I think it's important to be organized, and all the clinicians that are attending the Congress now should be aware that in their network of relationship, professional relationship, you have a radiologist, you have a medical oncologist, you have a radiation oncologist. And now we should seek and find and identify a genetician. I think it's very important because we are stepping into this new era of medicine where the blood will not be there, blood test will not be there anymore, but genetic test. And there is a learning curve to overcome when it comes to understand this genetic test and to have the opinion of a highly specialized colleague.